بالعافية يا جماعة. هاي مش صورتي. وأنا متعود أحكي the audience, not all physicians. Thank you for the invitation. I like just to introduce to you يعني somewhat what we do at King Hussein Cancer Center, but just to start warming up talking about impact of الصوت مش واضح؟ في مشكلة بالصوت؟ مايكروفون بس أظبطه هيك تمام. Okay. We'll talk a little bit about the impact of يعني ongoing technology, current technology, generative AI on healthcare, which I have to say before I start, that I think anybody can imagine the impact that generative AI will have on medicine in the coming 10 years. We can speculate, but really the impact may go far beyond what we think is going to happen. So, a question, what do patients need? And patients, when they come to us, they have expectations. Or they have hopes. When they come to the emergency room, they will get very quick access to their care. يعني بيدخلوا بيطلعوا زي grocery store. They will be treated with respect when they are admitted to the hospital. They will not lose their privacy. بحكي دائما الناس بتجمعوا في مكانين، يعني بيتجمعوا يناموا في مكانين غير بيتهم، سجون وفي الاوتيلات. المستشفيات للاسف تعلمت من السجون اكثر من المستشفيات. When you go to the hospital, you lose your privacy. في شخص مسموح له يفتح عليك الباب 2 a.m. get your vital signs, wake you up. You lose your privacy. It has to change. In a strange way, artificial intelligence will help changing this. When they go to the clinic, they want to get their care in and out, and hopefully they can get it at home. It's very convenient. Patients tolerate no errors in their care, of course. They need sympathy and empathy in their care, and they need to get health care at an affordable price. The healthcare workers كمان لهم expectations. أول شيء paperwork. The amount of paperwork, number one, cause of burnout among healthcare workers is electronic medical records. Time people spend, يعني زملاء التمريض، أطباء الممرضين, they spend in writing electronic medical records. Pajama time, يعني أنت وقتك لعائلتك بالليل, you sit on your machine and you finish your notes. The resources, the limitations of resources, the burnout زي ما حكينا for many reasons, أهمها paperwork. They need to deliver very high quality, very high standards. They need to keep innovating and طبعا following innovation. هذا الشيء بيتطلب وقت كثير من الطبيب, healthcare workers in general عشان يعرف what is the latest. So patients will receive the most updated treatment and they want to be paid well. So أنا يعني مش راح أحكي لكم عن AI. I think الناس اللي موجودين هون they know more than me. I have to say, medicine is built on regression, which is the basic foundation of AI. So we were not really far away from AI, but AI moved very, very rapidly. Now, with the birth of transformers, things changed in ways that nobody really anticipated. We are still, طبعاً, computer vision is a major thing, and there's so many applications in medicine. With time series forecasting, of course, is very important لأنه بيساعدنا to predict many things in the health system. And دايما I like to remind myself and everybody that this whole world changed when Attention is All You Need was published in 2017, because it changed artificial intelligence and changed everything again in ways that we never anticipated. فيكم اهتمامي الشخصي بهذا الموضوع طبعا شات جي بي تي سنتين اليوم احنا بنحكي عام 11 2022 شات جي بي تي 3.5 was released. أنا myself first time I was on Twitter, كانوا غيروا اسمه لسه بس everybody is talking about chat GPT. I didn't know what it is. And طبعا زي الكل I was shocked. بديت أحكي مع الشات جي بي تي. I don't know كل واحد فيكم بجوز عنده his own expectations أو يعني experience. But myself, I am still in shock حقيقة with this amazing technology. So I started experimenting with one thing, simple thing, not simple really. We had a child جاي من دولة عربية شقيقة was seen by 20 physicians in her country, came to us, visited many doctors, then came to KHCC, and we were in our multidisciplinary meeting discussing her case, and got 2 biopsies for her, no diagnosis. And this takes us to the word of no diagnosis, undiagnosed patients. And you may go to the doctor, go to the clinic, see the best doctor, and go out without a diagnosis. He may be very busy, missing your diagnosis, or may he not know, or he may not have the information, or may he not have the time to evaluate everything. So this child, 12 years old, had fever, generalized lymphadenopathy, pleural effusion, low ESR, which tells you there's no major inflammation. Bone marrow shows strange thing, few red cell aplasia. The PET scan shows a moderate SUV. It's not very high, so it doesn't tell us. Now, where we are going with this, I know you are not thinking like me, because I live with cancer, but when we hear the story, we think most likely this is lymphoma. Got 2 lymph nodes, they are negative. Bone marrow is strange, ESR is low. Doesn't make sense. طبعا PET scan lymphoma, it will be PET scan will show very high SUV. So this is not lymphoma. So we asked the question طبعا, and the answer immediately, as usual, came out beautiful, unbelievable. Multicentric Kesselman disease. I mean, this is the right diagnosis. I know the diagnosis didn't click to me or to anybody in the audience or any of the 20 clinicians who saw the patient in her country, or maybe 10 clinicians who saw her in Jordan. We asked the pathologist to look again at the lymph node, and pathologists are human. If you tell them to look for something, they will find it. If they don't, they may miss it. So this thing is very, very interesting. The knowledge, every time ChatGPT is tested against experienced clinicians, ChatGPT wins. This is against ophthalmologists, ChatGPT wins. In the ER, before, we had always dreams. I don't know if you know about Watson Oncology, an IBM project that failed miserably because we always thought about medical issues in the same way we think about, this is a decision tree. You do this, there's an algorithm. You do this, the patient has low blood pressure, high temperature, whatever. You go in this line. It didn't work. So there were models before, but when ChatGPT came in, this is a simple thing they did in UCSD. They looked at all their previous ER visits and asked ChatGPT-4 to read the notes and give a score. It was very accurate. It was more accurate than human evaluation. So another example. The examples are endless. I mean, every time we put these models in real tests, they do amazing things. The question is how we introduce knowledge to them, how we let them work, test themselves, work in agents that check the work of answers, think, chain of thought, etc. So radiology, imaging studies, very important. I'm talking about AI in medicine, radiology. 3/4 of FDA-approved AI models, which are now just above 1,000. It's not a big number so far, but they go to radiology because computer vision is very advanced. Chest X-ray is a simple test. All of you, it's cheap, simple test. We know, you can diagnose infection, if there's a fusion, certain things, but nobody thought that you can know the race of the patient, know if the patient has diabetes, or what is the level of diabetes control, bone density, mortality. Just by looking at the chest X-ray, we can predict mortality. We can predict your ejection fraction, IVC dilatation. These are medical terms, but instead of doing an echocardiogram, now let's just look at the chest X-ray, again, because AI looks in a different way. And then if we take this to a larger scale and train models, transformers can also see. And then we have now foundation models in radiology that are, in many cases, open and can be used. Their impact is still not realized. We are trying to understand how we can use these models in clinical practice. But of course, there's so much commercialization of this, and we see ourselves, because we live in a region where resources are limited, we have to see what can be afforded at low cost for everybody. And I think this is coming where you may really get excellent radiology interpretation in places where you have no radiologist. Poor quality images is always a problem. طبعا إذا المريض يتحرك أو did not have enough contrast or the machine was not well calibrated, you get poor image. You have to repeat the image and get more radiation. But thanks to AI, you can fix all of this. So this is an amazing application of AI. This is coming soon. You know, when we get an MRI machines are very expensive. They need huge rooms, high electricity, and precautions, so no metal be in the room, et cetera, et cetera. Why is that? Because we have to get very high resolution images, very high voltage images. Now with AI, we can get bad quality images and convert them to high quality images. So now we are talking about low voltage MRI. This is coming soon, actually. This will be very soon in medical practice, where you have a machine, just a regular electrical outlet. A small machine may fit in a physician's just a regular clinic, and get very bad quality images. AI will convert them to high quality images that are comparable to what we get with the best machines. It's an amazing application. Number of images done every year. This is in the States, but this is in KACC everywhere. We do more images for our patients. We rely more and more on images. Our physical examination today is a CT scan or MRI. This is a fact. So radiologists will have difficult time to survive if they don't know how to use AI. Medical students don't like to go to radiology anymore, but the fact is, I mean, this is just everywhere, but radiologists who use AI will replace radiologists who don't. So it's unlikely in our lifetime that AI will replace physicians. But definitely the human-machine loop is going to make miracles in ways we never anticipated. The handheld ultrasound is an amazing, cheap machine that will be in practice. It is in practice. And I think the handheld ultrasound will be in every home, thanks to AI. So maybe today, instead of having a thermometer, you will have an ultrasound probe that's connected to your phone and do ultrasound and understand maybe you have appendicitis, go to the ER, notify the doctor. Pathology كمان, computer vision also helped in pathology. I will skip a few of these slides because maybe they are technical in ways, but also pathology is a discipline that is really lacking in our region, in some parts of our region. طبعا, I know this region is very heterogeneous. Cardiology, reading ECGs, for example, a model where ECGs read, smart machines read ECGs in the ER and send notification to the ICU that you are getting a very high-risk patient with very high risk of mortality, decreased mortality of high-risk patients by 10-folds. Amazing, again. Amazing how the AI with the clinicians can do these miracles. Genomics, we are now, we have unbelievable amount of data when it comes to genomics and how we can sequence our patients. It's a simple application, it's amazing. Looking at methylation, which is a special type of sequencing, we can diagnose brain tumors with 99.9% accuracy. Diagnosing brain tumors, especially for children, is very difficult, needs years of experience. But now, thanks to methylation, we can diagnose that without even looking at the slide. طبعاً, alpha fold with a protein structure, this is by itself is a science that goes beyond description. All of this resulted in our first antibiotic ever manufactured using AI knowledge and studying the structure of proteins of the bacteria to manufacture new antibiotics. طبعاً manufacturing new antibiotics is very difficult, and it is an urgent really requirement for healthcare. Looking at the faces of patients and correlating this with genetic background, نحكي عن second generation phenotype. Just look at the face of a patient. You can get so much information that in a way, you may not really need to sequence the patient with the genetic studies. Just the face will tell you so much, as you can imagine. And this is already in practice. Face to Gene is an application that you can download on your phone. I always tell young residents to download it. Just take an image to the face of the patient, and you can get a diagnosis with very high accuracy in many cases. We did not anticipate the models to help us in psychological support. These models are amazing, sympathizing with the patient. This is a study that looked at the quality of answers of GPT compared to expert clinicians. GPT was more accurate, but more surprising, it was more sympathetic with patients than expert clinicians. Amazing. The impact of language models, transformers, and mental health are, again, this is a huge subject, and it's difficult to believe, but these models are really good in giving psychological support. I have to skip because this screen is showing me that my time is up, so there are so many issues related to ethics. Maybe this is where we need to spend time educating the young generation of doctors, importance of ethics, bias in AI. They will face this. This will be part of their daily living, if it's not already. It's an evolving issue. There's so many things to be said, and maybe this needs to talk by itself. When it comes to research, these models today are writing 10% of medical research and changing the face of research. And my prediction in the future, most of research will be written by AI, reviewed by AI, and read by AI. AI advanced models will be able to generate research ideas. Skip these, and thank you all.